And Adar, the Serum Institute has started shipping vaccines for COVAX, but 10 months since it was formed, it's been pretty challenging for COVAX to get its own supplies. Vaccine nationalism is still front and center, still very rampant. First of all, give us a sense of how bad it is. What's the pace at which COVAX is ramping up its purchases of the AstraZeneca vaccine, for example?
So, we've got agreements for hundreds of millions of doses with COVAX for the AZ vaccine and other vaccines like Novavax. Thanks to the stockpiling that I did, in 2020, at the end of 2020, we had a lot of doses. That gave us a head start. In fact, right now, we have supplied more than 50% of the doses that COVAX has received in the last 2 to 3 months. And, we're trying to scale up as fast as we can. And COVAX is doing a great job in trying to equitably distribute these vaccine doses to as many nations. And, between COVAX and some other countries, we've already reached about 50 countries globally.
We have U.S. President Joe Biden committing about $4 billion to COVAX. To what extent can that funding address the dire state of global vaccine inequality when the issue is not really the lack of funding, it is a lack of supply?
Absolutely. So, more than the funding, it's down to the manufacturers, really, on whom they want to prioritize. So if a Western manufacturer, Pfizer, Moderna, wants to sell to a richer nation at a higher price, there's nothing really one can do about it. I mean, they're also trying to balance out, their investor relations and other things to provide a good return and be ethical at the same time. And for us, because we're a privately listed company, I can be as ethical as I want to be with my entire stock. We're selling at an average price of $3 a dose for our vaccines. So, to give as much equitable access as we can. So it's not just the price, it's supplying the product, to these nations which can't get access to these other vaccine manufacturers as well.
It's hard to be patient when the situation is desperate, especially for some countries. Like you said, there are enough manufacturers. It takes time to scale up. Can COVAX then meet the goal of 2 billion doses by the end of the year?
I think end of this year will probably be challenging. It may spill over by a few months because, there are a lot of manufacturers who haven't been able to supply to their commitments and timelines, including Serum Institute to a certain extent, because, when India changed its view and mind that it wanted to consume a lot of doses, we've had to dedicate a lot of our capacity, which was not originally planned for India, now is going to the Indian citizens. We're trying to balance it out as much as possible. But again, for the first few months, we are being directed to prioritize supplies to India and certain other countries that also have a high disease burden. So, yes, I mean, it is going to take another 3 to 4 months for COVAX to really pick up in the large amount of doses that they will get from all different manufacturers, again, because of vaccine nationalism. And now a new thing that has started, raw materials nationalism. So what the US, for example, has done, and I've sent this message to all the decision makers in the US, that please do not put a ban on critical raw materials that other global vaccine manufacturers need to make vaccines. So under the Defense Act in the US, you've got a ban on plastic bags, filters, and certain other critical items that we're all dependent on. So that may also slow down vaccine manufacturing capacity in other parts of the world, including India.